Now let's talk about general adult tests. Body weight. It is important to keep to a healthy body weight, as being overweight or underweight can increase your risk of certain disorders. Your doctor may monitor your weight by weighing you and measuring your body mass index or BMI and waist size. Your weight depends on your age, your sex, height, shape, bone, and muscle structure, and fat distribution. It is also influenced by your metabolism, how your body turns food into energy, and lifestyle. Being overweight might not immediately cause health issues, but excess fat can put a strain on your joints and can raise your risk of sleep disorders, heart disease, high blood pressure, and diabetes. It is also important not to be underweight, as this can increase your risk of disorders such as osteoporosis. Waist and hip size. The doctor may measure your waist to see if you have excess fat around your middle, which can increase your risk of developing diabetes or heart and circulation diseases. The doctor may also measure around the hips and work out your waist-hip ratio to assess body fat distribution. Measuring your hips and waist. Use a cloth measuring tape or a piece of string. Wrap the tape around you so it is level and lies flat without digging in. Weight around the middle usually means that there is more fat near the internal organs, which might influence the way they function. So the formula for waist-hip ratio is waist measurement in inch or cm divided by hip measurement in inches or cm. So for waist size, healthy men will have 37 inches or less than 94 centimeters. Moderate risk would be 37 to 40 inches, and high risk would be 40 inches. For women, healthy waist size is 31.5 inches. Moderate risk is 31.5 to 34 inches. High risk is 34 inches. The waist-hip ratio for men, healthy waist-hip ratio is less than 0.9. Moderate risk would be 0.9 to 0.99, and high risk would be equal or more than 1. For women, the healthy waist-hip ratio is less than 0.8. Moderate risk would be 0.8 to 0.89. High risk would be equal or more than 0.9. So here you could see the comparison for the table showing the weight and height. Okay. So for obese, BMI is 30 or more. Overweight would be 25 to 29.9. Healthy weight is 18.5 to 24.9. Underweight would be a BMI of 18.4 or less. Body mass index or BMI is a calculation based on weight and height. It will show generally whether you are carrying too much or too little weight for someone of your height. It is not a totally accurate guide. For example, some muscular athletes may have a BMI suggesting that they are overweight, and BMI does not indicate fat distribution. In addition, BMI does not distinguish between men and women. However, it is still a quick and useful tool to help you assess weight-related health risks. So BMI is weight in kilos divided by height in meters times height in meters. You can check whether you fall in a healthy weight range by using the weight height chart or by calculating it yourself. This chart will show the ranges for adults only. So self-help measures, we should follow a healthy diet and cut down on sugar and salt, keep physically active, stick to regular sleeping hours, and try to reduce stress. Thank you for your attention.
Let's discuss interviewing love and hatred. It may seem strange to include love under emotional causes of disease, and yet all ancient Chinese books, including non-medical ones by Taoist and Confucianist writers, also had love at the top of the list of emotions, just after joy and anger. Love here means not normal love such as that of a mother towards her child or that between two lovers, but rather the condition when love becomes an obsession, or when it is misdirected, as when a person loves someone who persistently hurts him or her. In this context, love indicates a rather obsessive love for a particular person, a misdirected emotion focusing as on someone who persistently hurts the lover, whether physically or mentally, or narcissistic love. Obsessive jealousy would fall under this broad category. In these senses, love becomes a cause of disease. Love, in the sense outlined above, affects the heart and quickens chi. This will be felt on the left front position, heart with an overflowing quality, and the pulse will also be rapid. It may cause such symptoms and signs as palpitation, a red tip of the tongue, a red face, insomnia, and mental restlessness. For the summary, love affects the heart, quickens chi, consists in obsessive love, misdirected love towards a person who hurts us, jealousy and possessiveness, narcissistic love. Next is hatred. Hatred is quite similar to anger but differs from it insofar as it indicates a cold and calculating malice rather than uncontrollable and spontaneous outbursts that are typical of anger. When harbored for many years, hatred is a very damaging and destructive emotion. It affects the heart and liver and nuts and slows down chi. It can be felt on the pulse of the left-hand side with a wiry but slow quality. The symptoms and signs caused by hatred includes chest pain, hypochondriac pain, insomnia, headache, and palpitations. These manifestations include pain in some part of the body, as when hatred is felt for many years, it turns inward to injure only the person himself or herself. For the summary, hatred affects the liver and heart, similar to anger, nuts, and slows down chi. Thank you for your attention.
Let's continue our discussion on foot yang ming, or the stomach meridian. Now, stomach 4, or earth granary. Stomach 4, or the foot yang ming, is found 5.5 chun lateral to the corner of the mouth, as seen here in the illustration. Stomach 4 is also called earth granary, stomach link, linking confluence, or ghost bed. The crossing point of stomach and large intestine, or the point of yang chow mai. Located next to the mouth on the stomach meridian itself, the great storehouse. This point is called a granary because the mouth receives and stores the 5 grains. At this heavenly level of the head, it can be appropriate for spirit level, the satisfaction with life. When someone has no sense of harvest, it makes sense to see if they have sufficient reserves and stores to furnish one. Sometimes someone has a concept of the type of harvest they want, but their intent has been misaligned with the desired outcome, or that they have overlooked what they have reaped. Earth granary is indicated when the mix of the processing, rotting, and ripening and transporting has lost its balance. Indicated when a person is unable to resolve a problem or can't stop overthinking it, when there are problems with extracting nourishment from life and having reserves to call on in times of impoverishment, when there is a sense that nothing is enough. We need our granaries to be stocked at all levels of body, mind, and spirit, so there will not be weakness, distress, and anxiety. As a crossing point with the large intestines, partner with of the stomach in the yang ming, which is rich in qi and blood, this supports a nourishing aspect of this point. The influence of large intestine can help earth extract the richness of food and life and eliminate what is not useful. It expels wind through its connection with the Yang Chow Mai, removes obstructions from the channel, benefits tendons and muscles. Major local point to treat the mouth and face. Treatment of facial paralysis where the mouth is deviated. It helps expel exterior wind. It also affects the facial muscles and is used in aphasia. Indication, it helps body, mind, and spirit receive nourishment and satisfaction to eliminate exterior wind and facial paralysis, to affect the muscles of the face in aphasia, and regulate the face and mouth. This is a major point for the mouth and face. The deep pathway encircles the mouth and connects to REN 24. It can help in cases of indigestion, eating disorders, facial paralysis, trigeminal neuralgia, or deviation of the mouth. The stomach is the granary organ. It receives and stores the 5 grains. This point can indicate for someone who has no sense of their own harvest, helps the body, mind, and spirit to receive nourishment and satisfaction. Location. With the patient looking straight ahead, directly below the center of the pupil and approximately 0.4 tune lateral to the corner of the mouth. How to find this? With the patient looking straight ahead, the first points of the stomach channel are located on a vertical line drawn through the center of the pupil or the pupil line. Stomach 4 is located at the crossing point of the pupil line and a horizontal line originating at the corner of the mouth. The point is located in the nasolabial groove, approximately 0.4 tune lateral to the corner of the mouth. Ask the patient to smile in order to make the line more clearly visible. Needling, obliquely in a lateral direction or vertical, 0.3 to 0.5 tune or penetration method, transversely and subcutaneously, approximately 1.5 to 2 tune in case of facial paralysis towards stomach 6 for trigeminal neuralgia towards LI 20. Caution, the facial artery vein. Thank you for your attention.
Let's discuss kidney pattern, kidney essence, Jing deficiency. Kidney essence deficiency pattern concept. This is due to kidney essence insufficiency and manifests as developmental retardation, hypofunctional reproduction, and early senility. For the clinical manifestation, for children, there is developmental retardation, dwarfism, delayed closure of the fontanelle, mental retardation, weak bones, laxity of the bones. For males, there is scanty semen leading to sterility. For females, amenorrhea leading to infertility. For adults, low libido, early senility, tinnitus, deafness, poor memory, absent-mindedness, weakness of the feet, loss of hair, loose teeth, mental retardation, pale tongue, atreidy, and weak paws. These symptoms, developmental retardation in children, hypofunctional reproduction, and early senility in adults, but without an obvious cold or heat pattern. For the analysis of kidney essence deficiency, failure to transform qi and blood to nourish the bones and flesh bones, there is a slow development, dwarfism in children, delayed closure of the fontanelles, there's weakness. Failure to generate marrow and fill up the brain, there is mental retardation. Kidney manifests in the hair, there is alopecia. Failure to nourish the teeth, there's loose teeth. Insufficient marrow to nourish the ear orifices, there's tinnitus, deafness, poor memory, absent-mindedness, mental retardation. Failure to nourish the bones, the weakness of the feet, laxity of the bones, so resulting to hypofunctional growth and development. For insufficient essence, scanty semen leading to sterility, amenorrhea leading to infertility, pale tongue, atreidy, and weak paws, there is a hypofunctional reproduction. For the summary, kidney essence deficiency, etiology, long chronic illness, overwork over long period, poor development of the fetal stage. Accompanying pathology, kidney yang deficiency, kidney yang deficiency. For the signs and symptoms, impairment of intellectual function, osteodystrophy or poor development, developed bone structures, dizziness, tinnitus, weak, aching back and knees, infertility, impotence or lack of libido, loss of head hair or premature graying, loss of teeth, in children, retarded growth and development, short stature, sluggishness of physical movement, low intelligence, weak bones, retarded closure of fontanelles. In adults, there is premature senility, weakness of legs, difficulty in walking, dullness of spirit, slowness of physical movement. For the pulse floating, find empty leather. For the tongue, it is red without coating or pale. Treatment principle is to supplement kidney essence, bone marrow, kidney yang, enriched kidney yin. For the acupuncture treatment, we use bladder 23, bladder 52, kidney 3, spleen 6, GB39, needle with supplementation. Select further points according to symptoms. When there is dizziness, we use do 20 to 16, tinnitus, Sanjiao 17, GB2, Sanjiao 3. Lumbar pain, do 3, bladder 40, bladder 60, seminal emission, kidney 12, brain 6, heart 7, stomach 36. Relevant advice: a person who is kidney yin deficient must ensure that they get enough rest and relaxation, and they should not drive themselves too hard mentally or physically. Men who are yin deficient should avoid having too much sex. Pregnancy and childbirth will further weaken the Jing in a woman who is Jing deficient. They should avoid stimulants, especially coffee and caffeine. Foods that are attributed Jing nourishing qualities are royal jelly, eggs, raw caviar, seeds, nuts, propolis, pollen, bone marrow, brain, kidney, oysters, seaweed, and algae, artichokes, raw milk, nettles, and oats. Thank you for your attention.
Let's continue our discussion on palpation, the anterior fontanelle or the neck. Palpating the anterior fontanelle. This is used to examine sick infants. The normal infant's anterior fontanelle is moderately tense and pulsates. Its surface is level with the surrounding bone of the skull. In general, the anterior fontanelle begins to shrink in size when the infant is about 6 months of age and closes completely by about a year and a half of age. The anterior fontanelle often shows abnormal bulging, depression, or delayed closure. In general, a bulging anterior fontanelle signifies heat strength. It is seen in epilepsy and in dangerous stages of heat diseases. A depressed anterior fontanelle signifies an illness of deficiency. This may be due to prenatal insufficiency or malnutrition, which leads to insufficiency of brain tissues. Severe vomiting and diarrhea can also lead to a depressed anterior fontanelle, so can massive blood loss. Delayed closure beyond a year and a half of age occurs mostly in illness of genuine Qi deficiency, but also in rickets. Palpating the neck. The main purpose of examining the neck is to search for masses. The most important of these are the scrofula and goiter. Scrofula, known in Western medicine as tuberculous lymphadenitis, has the appearance of a series of swelling in the neck like a string of pearls. The swellings form rapidly and may be of variable size, the larger ones about that of a pigeon egg. If the swelling are hard and tender to pressure, they are mostly due to exogenous wind heat or phlegm heat collecting in the neck. Scrofula can also result when liver qi is unable to move freely and the spleen loses its dispersion and transportation functions. This leads to retention of water and dampness, which may transform into phlegm over time. The phlegm then collects in the neck. In this case, the lesions of scrofula form gradually and are hard. There is no tenderness or pressure, and the overlying skin remains normal. Early in their formation, the swellings are movable, but with time, some become matted to the surrounding tissues. Goiter. Goiter consists of swelling in the front of the neck on both sides, just below the main part of the larynx. It is not tender on pressure and the overlying skin remains normal. Goiter tends to enlarge progressively and is persistent and difficult to cure. When examining the neck for goiter, the optimal position for the patient is to sit upright with both hands placed gently on the knees so that the neck is fully exposed. The physician sits or stands either in front, facing the patient, or behind and uses both hands. Note especially the location, size, and shape of the goiter. Goiter characteristically moves up and down with swallowing. If the goiter enlarges diffusely with indistinct borders, is soft to pressure and expands or shrinks with joy or rage, and has normal overlying skin, it is a chi goiter. This is mostly due to dietary deficiency of iodine, repressed passions, chi stagnation, or blood stasis. If the goiter or partial and semicircular in shape has a smooth surface and is not tender on pressure, it is a flesh goiter. It is due to mostly to melancholic brooding or repressed rage, accumulation of gel dampness, phlegm, chi stagnation, or blood stasis. If the goiter is hard as stone, has an irregular surface, is unmovable, and is tender to pressure, it is a stone goiter. This is due mainly to chi stagnation, accumulation of gel phlegm, dampness, and static blood. It is mostly malignant. Thank you for your attention.
Let's now talk about liver qi invading the stomach. This pattern is very similar to the previous pattern in its pathological mechanisms and etiology, liver qi invading the spleen. There will also be an overlap between the two patterns, and both patterns can be seen in the same patient. The difference between this pattern and the other one is that in this pattern, the stomach will be more influenced by foods that are hot and ascending in their energy and will be less affected by food that is physically cold or has a cooling energy. Food can stagnate in the stomach if it is too difficult to transform, if too much is eaten at a time, or if it is eaten too quickly or too late in the evening. This will create food stagnation and thereby heat in the stomach, which may cause the stomach chi to become rebellious. Otherwise, the etiology will be the same as in liver chi invading the spleen. Symptoms and signs: abdominal bloating and abdominal pain that occur or are exacerbated by stress and emotional influences. Hypochondriac tension or tightness in the solar plexus region. Cold hands and feet, the buttocks and tip of the nose may also be cold. Nausea, acid regurgitation or heartburn, vomiting, burping, hiccups, irritability, mood swings. The person may have a hard or staccato voice, pale tongue with red sides or red speckled sides, wiry pulse in the left quan position and weak pulse in the right quan position. Sometimes the pulse is wiry in the right quan position. Key symptoms: abdominal bloating, cold hands and feet, belching, and a wiry pulse. Treatment principle: harmonize stomach and liver by tonifying stomach chi and spreading liver chi. Acupuncture points: choose from stomach 21, 36, Ren 10, 11, 12, 13, liver 3, 14, pericardium 6, GB 34, bladder 18, and 21. Needle technique: draining technique on liver 3, 14, pericardium 6, GB 34, Ren 13, stomach 21, and bladder 18. Tonifying technique on stomach 36, Ren 10, 11, 12, and bladder 21. Liver 3, bladder 18, and GB 34, spread stagnant liver chi. Pericardium 6 and liver 14, spread liver chi and regulate chi in the middle jaw. Ren 13 and stomach 21, regulate rebellious stomach chi. Stomach 36, Ren 10, 11, 12, and bladder 21, tonify and regulate stomach chi. The advice that was given for the pattern liver chi invading the spleen is relevant here. The person should also avoid food that has an ascending dynamic. For example, chili. They should also avoid eating food that creates food stagnation, eating too late at night, eating too quickly, or eating too much at a time. Stroking the fingers down the Ren channel from Ren 15 down to Ren 9 after a meal can help descend stomach chi. Liver qi invading the stomach patterns can be caused by stomach qi deficiency, liver qi stagnation, spleen qi deficiency, food stagnation, damp, and can result in stomach fire, stomach yin deficiency, spleen qi deficiency, food stagnation, damp, and phlegm. To summarize, liver qi invading the stomach, the etiology would include states of resentment, frustration, and anger over long periods of time. Underlying accompanying pathology is liver qi stagnation. Signs and symptoms, hypochondrial or epigastric distension, sighing, hiccup, nausea, and vomiting of sour fluid, poor appetite or aversion to food, diarrhea, dizziness, belching, churning sensation in the stomach, irritability, breast distension, and tenderness in women. Pulse, wiry, especially on left middle position. Tongue, normal color, sides may be red. Treatment principle, calm the liver and harmonize middle burner, supplement stomach qi, regulate intestine. Acupuncture treatment, bladder 21, regulates center, harmonizes stomach. RAN 12 harmonizes the stomach. Stomach 36 supplements stomach and spleen qi. Stomach 25 regulates large intestine. Spleen 6 supplements spleen, regulates liver. Stomach 21 harmonizes the middle burner. Needle with supplementation. Bladder 18 regulates liver qi and blood. Pericardium 6 lowers rebellious qi. Liver 3 courses liver qi, subdues yang. Liver 14 harmonizes liver qi in the middle burner. GB 34 courses liver qi. Stomach 19 lowers rebellion. Sanjiao 6 benefits lateral costal region. Needle with drainage or even method. Thank you so much for listening. Inspection of infants' finger venules. We discussed the color, appearance, location. This is a special diagnostic method, usually for children below age 3. In an infant, taking the pulse in the usual way is difficult because of the infant's small size and restlessness. This special method is devised because the infant's skin is thin, so the superficial venules are readily observable. The venules of the index finger are used since they are branches of the long meridian of the hand tai yin, so that their diagnostic significance is the same as that of the usual pulse. The correct procedure is as follows. Ask a parent to hold the infant facing the light in a bright place. Hold the infant's index finger in the left hand. With the right thumb, gently massage the medial aspect of the infant's index finger from the tip to the palm. Repeat this several times in order to make the venules more prominent. In observing the venules of the index finger of an infant, pay close attention to their color, appearance, and location. The normal color is faintly red or yellow, not strikingly so. There are 5 abnormal colors: red, purple, blue, black, and white. Bright red suggests exogenous wind cold. Purple suggests heat. Blue suggests pain or fright. And dark purple suggests blockage of blood vessels. White is not seen per se, but makes the other colors lighter. In general, light red indicates deficiency cold and light purple deficiency heat. Appearance. This includes whether the venules are deep or superficial, thick or thin, and straight or curved. Superficial venules suggest an exterior illness, whereas deep and indistinct venules suggest an interior illness. Thin and light-colored venules are mostly seen in deficiency syndromes of illnesses, whereas thick and strong-colored venules are mostly seen in illnesses of evil strength. Oblique venules without branching are mostly seen in mild illnesses, whereas venules with multiple branches are mostly seen in severe illnesses. Location refers to the wind, qi, and life passes. The wind pass is the flexural crease over the metacarpophalangeal joint. The qi pass is the flexural crease over the proximal interphalangeal joint, and the life pass is the flexural crease over the distal interphalangeal joint. The location of visible venules reflects the strength of evil qi, and the severity of the illness can be assessed. Visible venules at the wind pass suggest an illness that is relatively mild, superficial in location, and recent in onset. If the venules become visible at the qi pass, then the pathogenic evil has entered the interior and the illness has become more severe. If the venules become visible at the life path, even reaching the fingertip, then the illness is critical and the prognosis is poor. Thank you for your attention.
Now let's talk about the erectile dysfunction, the ancestral muscle, penetrating vessel, and the penis. The ancestral muscle, the penetrating vessel, and the penis. The term Jing is mentioned in the classics, usually in the connection with the penetrating vessel. The meaning of the term Jing, literally ancestral muscle, is the subject of varying interpretations. The two main views are that this term refers to the rectus abdominis muscles, the muscles that run either side of the midline, or that it refers to the penis. There are passages in the Old Text that would support both opinions. The rectus abdominis muscles are muscles that run vertically in the abdomen, either side of the midline, attached to the xiphoid process and lower ribs above, and the symphysis pubis, or the pubic bone, below. Chapter 44 of the Simple Question mentions the ancestral muscle. The penetrating vessel is the sea of the channels. It irrigates the rivers and valleys, and it connects with the bright yang, stomach channel, in the ancestral muscle. Thus, yin and yang meet in the ancestral muscle and connect with the avenues of the abdomen, which are under the control of the stomach. They are all restrained from the girdle vessel, or diamai, and connect with the governing vessel, dumai. The above passage, rivers and valleys, refer to large and small meeting points of the muscles. Yin and yang refer to the penetrating vessel and the stomach channel, respectively. As the penetrating vessel runs along the kidney points, which are 0.5 con from the midline, and the stomach channel points, which are 2 con from the midline, they broadly enclose the rectus abdominis muscles in between them. In fact, the kidney channel lies on the medial border of the rectus abdominis, and the stomach channel lies on the muscles itself, but towards its lateral border. The rectus abdominis originates from the xiphoid process and inserts in the pubic bone. Therefore, the points kidney 11, Hingu, and stomach 30, Chong, are directly over the insertion of the rectus abdominis. That is another reason why the kidney and stomach channels control the ancestral muscle. The clinical note: the points kidney 11, Hingu, and stomach 30, Chong, are right over the insertion of the rectus abdominis, and the kidney and stomach channels broadly enclose the rectus abdominis. The kidneys house the prenatal chi, and the stomach the postnatal chi. It is probably for this reason that the muscle was called the ancestral muscle. Thank you for your attention.